Don't rush through lunch. Take 2 hours and spend it with a friend. This is the Joan Hamburg Show. Joan is New York Radio's First Lady.
The story continues to dominate not only press in this country, but all over the world.
She's got a menu for every appetite. News you can use. The biggest celebrity guests. Today's top headlines.
Everyone's got a hand in that pocket somewhere trying to figure out how they can benefit.
And more. Pull up a chair and enjoy. Now, here's Joan Hamburg.
I was recently at a party, and one of the guests was a gynecologist, obstetrician, and during the course of the evening, he told me that he was now involved, in addition to his regular practice, in plastic surgery. I must say that I was really surprised, and then I pick up a piece that we got on healthnewsdigest.com, and it was called Considering Plastic Surgery, Make Sure Your Plastic Surgeon is a Plastic Surgeon. So I am going to introduce you now to Dr. Adam D. Schaffner, a plastic surgeon, a fellowship-trained plastic surgeon, and an assistant clinical professor at Weill Cornell. And what is going on, doctor? How come, and I learned that this man I met at a party was not the only one, that a lot of these people are suddenly adding plastic surgery to their expertise?
Well, I think it's a great question, and thank you so much for asking it. And I think what's going on is that you have a lot of doctors who are practicing in the field in which they were trained, who are not, unfortunately, getting compensated at the level which is really worthy of their services for representing all of their knowledge, training, and skill. And part of that has to do with health insurances and health reform and things beyond the scope of this discussion. But suffice it to say, they're trying to survive and to augment their bottom line. And to do so, they're trying to perform procedures that are not covered by health insurance. And one of those types of procedures is cosmetic or plastic surgery. And so as opposed to going through the lengthy process of going back into training, becoming a resident and or fellow, and becoming a plastic surgeon through the traditional pathway, they may go take a weekend course, or they may go and take a week off and go observe somebody, and then go back into their practice and try to perform these procedures. And there's nothing in the law that prevents them from doing that. As long as they have a medical license, and that's any MD or DO, they can go ahead and perform these type of cosmetic plastic surgery procedures. And of course, they can wind up really causing problems for patients if they don't have the knowledge, training, and skill that a plastic surgeon has.
I am really surprised because there are lots of internists who have other, titles on their name. Maybe your internist is a specialist in rheumatology or something else. I thought you had to have special training and degrees in all these subfields.
And that's a great question. Within internal medicine, there are a number of specialties, such as cardiology for the heart or pulmonology for the lungs. And you do complete a fellowship after an internal medicine residency to be able to call yourself, say, a cardiologist or a pulmonologist. Now, if you note, these OB-GYNs or obstetricians or gynecologists or oral surgeons, they're not calling themselves plastic surgeons. They're calling themselves cosmetic surgeons or aesthetic surgeons. And that's the difference in the nomenclature. They're not going to call themselves a plastic surgeon, even though they're performing procedures which we all in the lay community call plastic surgery. So the real question when doing your homework is to ask your doctor, are you a plastic surgeon? And if so, are you board certified? And not only are you board certified, but by whom are you board certified? They could be a board certified obstetrician and gynecologist and be extremely well trained there, but they're not a plastic surgeon. They could be a board-certified oral and maxillofacial surgeon, somebody who does oral surgery, but they're not a plastic surgeon. So suffice it to say, it pays to do your homework.
And is it important to ask about hospital affiliations? Because today a lot of doctors have their own little clinics in an office. Do you need to know that that physician is affiliated with a hospital in case something goes wrong?
Absolutely. It's critically important to make sure that your plastic surgeon has privileges at a nearby hospital for the procedure that you're interested in. And it's perfectly fine to have a surgical procedure performed in an accredited outpatient surgical facility outside of a hospital. There are many that are excellent, and in fact, they can sometimes provide care that's even better because patients who have very bad types of infections aren't necessarily being operated on there as they are in the hospitals. So there are actually some studies which have shown that it can be safer to have procedures in those accredited outpatient surgical facilities, but I want to emphasize that it should not just be a procedure room in a doctor's office, but an accredited operating room using, if you're going to have anesthesia, by a board-certified MD or DO anesthesiologist. Those are the things which will be very important to ask if you are considering having plastic surgery. And as you state, the reason for having hospital privileges is that there's always risks that are associated with any type of procedure that someone might consider having. And in the event that you need to utilize the services of a hospital, it's important to know that your plastic surgeon is able to help care for you not only in the outpatient setting, but also as an inpatient at a hospital as well.
My guest is Dr. Adam Schaffner, and the doctor is a fellowship-trained plastic surgeon. He's got other specialties, too, a facial plastic surgery, head and neck surgery, and also involved in teaching at Weill Cornell. So is it true that dentists are now involved in this, too, not just physicians?
It is true. So dentists are injecting Botox. They're injecting facial fillers such as Restylane or Juvederm. And in the state of New York, there are some oral surgeons who are subspecialists within the field of dentistry who want to, in fact, perform plastic surgical procedures in the head and neck region, such as facelifts. There is some legislation right now pending before the New York State Senate, which would allow these oral surgeons to perform these types of procedures. And one may ask, why is it that an oral surgeon would want to do these types of procedures? And again, it's the same things that we were talking about before. But in my opinion, it would be better for some of these oral surgeons who are considering performing such procedures to go back and train as a plastic surgeon or facial plastic surgeon to really get the proper credentials to be able to perform these procedures. And there are many oral surgeons out there who have done that, who are dual degreed, MD, DDS, MD, DMD, who are certified in both oral surgery and plastic surgery and have great results. But to try to circumvent that training process and go to the state legislature to try to sort of work around that, I don't think is in the best interest of patient safety.
Well, at this point, Dr. Schaffner, when this is becoming more prevalent, isn't there a way to make this mandatory? Extra training or certification in these other areas?
Well, that is a topic of hot debate, and while I'm a plastic surgeon, I'm not an attorney. So I'm sure that there's a way to make it mandatory, but it would require state and or federal laws that would make such training mandatory. And at least at this time, there are different laws in different states and no universal laws on a federal level other than stating that you have to have a medical license in the state in which you're practicing.
Yes. So I have a feeling this topic is going to become more and more prevalent as we have more and more issues with insurance. And as I think you point out in one of the articles I read, that it's like people say, how come our food is so contaminated? Well, Americans want cheap, cheap, cheap. So you run into a lot of problems, and that's what's happening, right? They want bargains, and they're really, buy cheap, you get cheap, is what my husband always says.
I think that there is some truth to that. We all know in life that you get what you pay for, and this is no different. And I think that is the one thing that these doctors are trying to really advertise over plastic surgeons, and that is saying low price. If you look and pick up throwaway newspapers and magazines where you have some of these people advertising, they're not advertising their credentials and they're not advertising their expertise in as much as they're advertising the price. Whereas when you look at a lot lot of plastic surgeons, they're really emphasizing their training, their knowledge, their skill, their experience, and they're not necessarily focusing on the price because the price is higher in many cases. And yes, that may serve as a deterrent for some, but what I would say is you get what you pay for, and in many cases, in order to go ahead and fix problems caused by improperly performed surgery can actually end up being much more expensive than if they had just paid at a higher price the first time around.
Adam Schaffner is a fellowship-trained plastic surgeon in private practice here in Manhattan. You can go to his website. Is that true? drschaffner.com?
Absolutely. www.drschaffner.com or call 212-688-6600 and be more than happy to answer any questions.
And find out more. All the best to you, Doctor. Thanks for your time.
Thank you.
My pleasure. I'm Joan Hamburg, and we hear these stories about, my gosh, I went to a dentist and he said, oh, I can do Botox, or my gynecologist, like this guy I met at a party, says, I'm now doing mini facelifts. Have any of you had bad experiences, or what is your feeling about this? They are much cheaper, and that seems to be the draw. 1-800-321-8828. 1-800-321-8828. Your turn. All right, everyone, welcome to WOR. Our topic was how many doctors are suddenly shifting into plastic surgery without the right credentials or the right training, and we turn to you to ask if you've ever had an experience. If you do go for plastic surgery, do you ask your qualifications, your training, before and after pictures? Marcia, go ahead. You're on WOR.
I have to tell you, I agree with you 150%. I'm a retired operating room nurse, and I worked for many years as a private scrub nurse for a plastic surgeon. I've had the experience that a doctor wanted to hire me to be his private scrub, and it turned out he was a gastroenterologist. And I said, I'll try you out for one day. Let's see what happens. And it was a man who was operating on, he had gynecomastia, which meant he had breasts, and he wanted them removed.
Right, so it was a guy which is, I understand, not uncommon in a lot of men, right?
Exactly. And he came to this doctor, and I'm sure it's because of price. Mm-hmm. And it was him and an OBGYN. Come towards the end of the procedure, the guy's under general anesthesia, and they don't know how to figure out whether the tissue is even.
Aye.
Both sides. I, the nurse, had to tell them how to do this.
What a mess. I thought that was basically a liposuction procedure, no?
Exactly. It is a liposuction. But they didn't know to measure the output, didn't know to measure this.
Gosh.
You have to hold the arms up where you can see how it looks. I mean, if I walked out of there and I said, I'm getting out of here.
That guy would have been in trouble.
I'm not going to get called in on a malpractice suit. So, I mean, I'm glad you're saying this because people are going by dollars and cents. They're better off if they want to save money. Go have a fellow do it under at a hospital with an attending. If you can't afford it, don't let anybody else do that.
Or if it isn't something crucial like the guy, had a real issue, don't do it at all.
I know, but I feel sorry because there are people that can't afford it, and it affects their ego.
Right. I guess you're right.
And that's sad. The plastic surgeon I worked for did noses, and these people were transformed because they liked themselves.
No, it's right.
Yeah. So.
Thank you, Marcia. And Marcia knows from when she came. Pat, go ahead.
Young. Good afternoon. Joan, it has not happened to me personally. However, I worked closely with someone who knew a young lady from the Brick area of New Jersey. She was self-conscious about her shape, and she shopped around for what she could afford for a liposuction. She went to a dentist who took a weekend course.
A dentist? Aye.
Yes. Her anesthesia was Valium.
You can't do that.
And sent home with compression stockings. I know her name is Lisa. I don't know the last name. It happened a number of years ago.
So what happened to her? Do you know?
They read a magazine, and the family was on a talk show. She died.
Oh, no.
She died from liposuction. That's what he performed, and he was not certified. He took a course, a video course.
Whatever happened to him?
I don't know. I never got.
But you know what, Pat? I'm so glad you guys are calling, because this is becoming more and more prevalent.
Yes, it is.
And when you see, I'm telling you, I was at this party, and this guy who was a obstetrician, gynecologist, said, I'm doing a lot of plastic surgery now, if you know anyone. Like, why?
Joan, they can't reduce, from what I understand, Botox comes from, there's a lab, I believe, in Ireland. And Botox is pretty much regulated in price. I think it's like about $400 for that vial that they use.
Right, whatever. And a lot of times it's used for real medical reasons.
Yes, other medical reasons. But how much can you possibly be reducing from someone who just took a weekend course?
I know, it's frightening. Thank you, Pat. I appreciate your taking the time. Judy, go ahead.
I'm sorry. Hi, Joan. Your speaker did not emphasize one point that he mentioned kind of in passing, and that was that these doctors that do this feel that they're not being properly compensated for
dealing with insurance today.
Right. Yes, and I think that is you're going to see this get worse and worse. And I think if this Obamacare stays in effect or goes into effect, because even now, I mean, what doctors get paid, I mean, it's just utterly absurd. And it's not that they all have to become billionaires, but I mean, they should be at least compensated sufficiently, maybe as well as we compensate our plumbers. I mean, because literally some of these doctors spend this time with a patient and they get reimbursed maybe, $69 because they spent 45 minutes with a patient?
No, it's an issue, and we've seen tremendous changes in medicine, and believe me, it's happened long before the president was in there. It's the way it's any of this, when it's got to be approved and paid for, none of which, like plastic surgery, is cash, which is why these guys want to go into it.
Oh, sure, of course. Yeah.
But it's an issue. Are you married to a doctor, or you are a doctor?
Well, my husband is a physician, and he puts in an 80-hour week, and, the thing is, we'll hear other doctors talk about, I see, 45 patients a day, and my husband said I would be embarrassed to tell someone I saw 45 patients, because that would immediately let you know that you couldn't give them enough time.
Yeah, you're not practicing real medicine.
And this is basic, so in order to be doing the right thing, and you are responsible for these people, you have to put in the time to do it the right way and treat people properly. And if you don't make the money, so you don't make the money. But I mean, it puts doctors, not everybody is quite as ethical as my husband.
No. And a lot of doctors I know have gone out of the actual practice of medicine and gone into administration because it's just too tough.
Yes, and I just, wish that something could be done about that, because you're going to see this happening more and more.
No, I'm with you, and I think we've reached a time when we may have to absolutely insist upon legislation. There's no way someone can take a video course or an online course and practice, and people have to know, they have to be certified. Leslie, go ahead. You're on WOR.
Hi, Joan. How are you today?
Good, thanks.
I really felt I had to comment on this, and I'm glad I got through. I had 3 courses of Restylane performed by...
Yeah, let me explain. Those are fillers that are used usually, plastic surgeons, cosmetic dermatologists, MDs usually do this, and it gets rid of lines, smooths out these things. Okay, so you had 3 courses done by whom?
By plastic surgeons.
By plastic surgeons.
And it's expensive, it's $700 to $900 a vial. And my fourth course, I decided to have from my dentist because
Why?
He told me. Well, first of all, it was half as expensive.
Right, that's been the issue.
It was the money. It was all about the money. And he is an excellent dentist. He's a cosmetic dentist, and he's excellent. And I've used him for many years. I've had a lot of work done on my teeth, so I thought, well, this would be perfect, and it didn't turn out well.
What was the difference? Like, what happened?
Well,
you had a lot of success with the plastic surgeon,
yes,
right?
Yes, I did. Firstly, it took him twice as many vials to complete the same procedures that the plastic surgeon had
So
done.
there goes the bargain.
That's right. Mm-hmm. And then I developed 2 pockets under my chin, on the sides of my chin, 1 pocket on each side, which looks terrible.
What's that from?
That is from the injection not being placed in the right spot.
So now what can you do?
I have to go back to a plastic surgeon.
Ugh. Or you could just tough it out for the months it takes.
Yes, well, that's what I might have to do for a while now. But it was
a hard lesson, Leslie.
It
right?
Surely was.
And you know, and the thing is, he's probably an excellent, as you said, dentist.
Excellent.
Was he all upset by this?
No, he said it would straighten itself out.
Which it hasn't.
No, and I really don't want to go back to him, Joan, to have him fix it.
No, you can't go back to him.
Right.
You can either, how long ago did you have it done?
About 4 months.
All right. If you can hold on for another 2 months, you know, usually that stuff dissipates in 4 or 5 months.
Yes, and that's why it becomes so expensive, and that's why I chose my dentist to do it, because I couldn't afford it anymore.
But you know what? That's what's happening. It's all about money. These guys get money, cash for it. No insurance covers it, but the patients are really the guinea pigs. And you know, it takes a lot of skill because, as you said, not getting the material, it's knowing where to put it. And it's only done well by people who do this day in and day out. I wish you luck. Thank you, Leslie. I'm Joan Hamburg, 13 minutes before 1 o'clock, 1-800-321-8828. Stay tuned.